going to be performing now the thorax and lung exam on this patient. So first I'm going to always inspect and looking at the patient's breathing, noting her respirations, they're even, they're normal, not too shallow. Everything looks good with that. So now I'm going to listen to her. I'm going to start with the front and then move towards the back. And then can you just take, every time I touch her, just take a breath in and out. Yep. Okay, I'm going to listen to the back. There we go. Just in and out. Moving side to side down the back of her chest. Her lungs sound clear and even. I'm going to listen to the side here. Okay, everything sounded good. If she would have had wheezing is kind of when you hear the air trying to come through, or crackles, which is fluid in the lungs, but hers were just clear, normal sounding lungs. Next I'm going to percuss her chest right here and listen for the sounds, and you should hear a resonant sound, which is normal. Hyperresonance would be like if there was air or fluid in her lungs. And then dullness is when you're over if you're over an organ or something like that. But so I'm going to percuss. Just a little easier on her back, so I'm going to go to her back and percuss. It's kind of harder to hear it through the patient's clothing, but if they had on a gown. But it sounds good, resonant. Now I'm going to look at her chest. I'm going to describe, there's different types of chests we have. There's like a barrel chest, when the front and the back is kind of like bigger towards the top than the bottom, and that can be emphysema, which hers looks normal. Scoliosis is when her spine can be like curved to the side, and that's abnormal as well. Kyphosis is when you have like a hump kind of like in your neck area. Pectus excavatum is when you have a caved in or sunken appearance, and she doesn't, and she's breathing normal. And then pectus carinatum is kind of when it's not sunken, but it's kind of like bloated out a little bit. But her chest looks normal, her respirations look even and regular. So that's all.